It's now off that floor and stands at $217. Joining us now, Johnson & Johnson Chief Financial Officer Joseph Wolk. The president's push to cut drug prices by 90%. Again, great for patients and consumers. What about Johnson & Johnson?
Yeah, well, Liz, thanks for having us here today and your interest in Johnson & Johnson. I know there's a lot going on, but we're doing great things for patients. We're working collaboratively with the administration, just like we did when we put a marker down of $55 billion of investment here in the U.S. We've been here for 140 years. We take pride in being an American-based company. We did the same thing with this recent MFN deal, where we've reduced drug prices for patients by hundreds of millions of dollars. That's in the current forecast that's contemplated. That's well above Wall Street expectations for 2026. And we're going to continue to do what's really at the heart of Johnson & Johnson, and that's innovating for better patient health care, extending the lives in a quality manner.
Does it sound right? Because you have struck a deal to have Johnson & Johnson drugs on Trump RX, I believe, or on their platform. 90% drop in prices?
Well, Liz, I think we need to look at deconstructing the actual amount of money that manufacturers get. On average, and this is true for Johnson & Johnson as well as most major pharma companies, 50 to 60% of every drug dollar goes in the form of discounts and rebates. Yet patients aren't experiencing that benefit in their pocketbook. We need to look at the pharmacy benefit managers. We need a higher degree of transparency around the insurance companies. There's things called copay accumulators, which we actually provide a voucher to the patient to reduce their copay. That is not allowed by the insurance companies to count against their deductible.
See, this has enraged President Trump, and he has said, I'm getting rid of the middlemen. We'll see how he does that. But that engenders a huge cheer from most people because this is outrageous. My dad was a doctor. He used to say, you want to see how much money the insurance companies are making? Go look at their headquarters in these gleaming skyscrapers.
It's what most people understand, right? What's your copay? What's your insurance premiums? Those have skyrocketed. I can tell you, on average, the industry has gone down 4 to 5% annually in net prices each and every year for the past 8 years.
Let's talk a little bit about why the stock initially sold off. You had the expiration last year, I believe, of Stelara, one drug therapy. And you lost the the patent protection. It was a blockbuster autoimmune treatment. And there was certainly a pullback in people buying that drug. They went with the generic. Sure. How do you fill that gap?
It's nice to see that we've had almost a 45% reduction in Stelara sales, $4.4 billion, yet our pharmaceutical unit, which is now $60 billion, grew about 5% operationally last year. That is just really, I think, the stepping stone for years ahead for further growth. We anticipate over the next few years to have a steady cadence of growth. 2025 was the start. By the later years of this decade, we foresee a double-digit earnings and sales cadence to this business.
Electrophysiology.
Yeah.
That part of your sales decelerated. First of all, explain to people what that is and what it actually means. How do you look to kind of reignite that?
Yeah, so the team has actually done a very good job in terms of reigniting that. To go back to your first question about simply what it is. So the heart is monitored for electrical pulses. We see where the circuit is kind of malfunctioning and then ablate it to repair the heart procedure so that it's pumping appropriately on the right cadence. That's a finance explanation, not a scientific explanation, clearly. But what the team did is they continued to innovate. We were the market leaders by a lot going into 2024. We were a little bit behind on some of the newest innovation known as pulse field ablation. It's different than RF ablation, and it leads to, it's suggested that it's faster and it's safer. We now have a product out there. We're going to continue to innovate new catheters 1 to 2 new catheters every year for the next couple of years. We think we're going to reassume our market leadership in PFA.
You're telling me that you're a 100-year-old company, but that you are much more fleet of foot these days, and that obviously gives a nod to those in your labs, your technicians, your doctors, your scientists. To that end, the stock price over the past year has been a real winner, up more than 47%.
Right.
So what do you do to continue that with some cross currents, whether they be other tariffs, although the president has said he's not going to impose the new tariffs on the European nations. But some tariffs do affect you in certain ways, even though you manufacture here.
Yeah, you know, Liz, I think we're going to do what we've done for 140 years, and that's continue to innovate and go to where there's areas of unmet medical need. If you look at our company right now, under Joaquin's leadership, our CEO, we've got great focus. We've got 3 strongholds in pharmaceuticals: oncology, immunology, and neuroscience. On the medtech side, it's cardiovascular, where we're the fastest growing cardiovascular company. You've got surgery, where we've just submitted a de novo approval filing with the FDA for a digital robot sometime next year, hopefully. And then lastly, vision care. And those where we're going to focus and be continue to innovate and continue to help patients in a meaningful way, extending lives. We're talking not about just treatments anymore. We're talking about cures in many cases.
Well, I don't know. We've got 25 minutes before the closing bell rings. J&J could very well turn positive. It's down literally just a fraction right now. We'll continue to watch it.
We're there for the long term, Liz.
Very important. Most investors should be in all investors.